Good evening, everyone. This is PrEP and Sexual Wellness with Ashley Cobb. Ashley Cobb, your favorite friend in filth, is an Atlanta-based sex educator, writer, and HIV activist known for her open and forward-thinking approach to sexual freedom, sexual pleasure, and practical sex advice. Ashley is the millennial microphone for women of color seeking sexual liberation and the ultimate pleasure. Her work has been featured in top media outlets such as Essence, Huffington Post, Cosmopolitan, and Women's Health. As a certified sex educator with a background in public health, Ashley has dedicated her life to bringing Black sexuality to the forefront and across generations. Currently, she serves as a CDC Let's Stop HIV Together ambassador, working diligently to spread awareness and understanding of HIV prevention. Ashley is committed to providing quality, practical sex education with a pinch of wit and humor. With her warm, down-to-earth personality, Ashley has become the go-to source for everything related to sexual health, pleasure, and wellness. So everyone, let's welcome Ashley.
Hello, everybody. That was a great introduction.
Thank you.
So, am I the host now? So I can share the screen or
I am making you the host now.
okay. So, like stated, my name is Ashley Cobb. I am a sex educator by trade. So I talk about sex for a living. All types of sex, talk about pleasure, how it relates to women, talk about prevention, all those things. So this is what I do for a living. So today we're going to talk about PrEP and what that is and why that's important to Black women. So I am a PrEP ambassador for ViiV Healthcare, which is under GlaxoSmithKline. And what I do is I go around the country and I share my experience on PrEP, why I think Black women should be on PrEP. So for those who don't know, PrEP is a preventative medication that prevents people from acquiring HIV. And that's what we're talking about today. But I like to say, so today I had my 2 month. When you're on PrEP, you have to go to the doctor every 2 months, every 3 months. So I go every 2 months. I'll share why that is later. But today I got my little blood work done, my tests and stuff done, and then I got my new prescription, which I'll talk about what that prescription is in a second. Okay, let me share this. Hold on. I did that wrong. Hold on. Okay. Share screen is here. Okay, it's loading. Hopefully it loads today. Okay, hold on. Okay, here we go. So we're talking about Black women in PrEP and what that is and why it's important for Black women to get on PrEP. So again, my name is Ashley Cobb. I am a sex educator. I'm also a PrEP user. And like I said before, I go around and I talk about sex from a woman's standpoint. Okay, so I wanted to get where everybody was from. So this is supposed to be hold on a second. This is supposed to be a link that pops up. Let's see if it works. That's not it. Hold on a second. Okay, let's talk. So in the chat, where is everyone from? What city, what state? So we can have a little interaction and I'll figure this out later. All right, let's see. Oh, New York, the Bronx, okay. San Diego, California, okay, cool. So I currently live in Atlanta, but I am from North Carolina. I am from the same place that J. Cole is from, the rapper. I don't know if anybody know who J. Cole is. I'm from the same place he's from. I've never visited San Diego. It's on my to-do list to visit. And I was in New York a couple of months ago. Oh, you went to Clark. Funny thing about Clark. I was supposed to go to Clark too. I came to Atlanta for a college tour back when I was in 11th grade. This was around the time Drumline came out. So that's how old I am. And I fell in love with Clark Atlanta, fell in love with it. Applied to Clark Atlanta, got into Clark Atlanta. Clark Atlanta at the time, it still is, it's private. At the time, I think it was like almost $30,000 a year. and they only gave me like 20,000 to get in. So it was a school in another HBCU in North Carolina that gave me a free ride. So my mother was like, you're going to the school that's free. So I went to this free school, but I really wanted to go to Clark. And I still regret not going to Clark. Even though I enjoyed my college years, I still regret not going to Clark. Okay. All right. What happened? So oftentimes when I am doing presentations, you'll hear me say the term, I am HIV possible, right? I say, my name is Ashley Cobb and I'm HIV possible. And I say that because one, it gives people's attention and they'll be like, oh my, what does that mean? Being HIV possible means that because I am someone who is sexually active, I have the possibility to acquire HIV. It helps people to make it relatable. A lot of people feel as though HIV is something that they can't acquire, it's something that it won't happen to them, blah, blah, blah. But the first word in HIV is human immunodeficiency virus. So in order to acquire HIV, you have to be human. So if you are human, male, female, whatever, if you are human and you are a human who is having sex, you have the possibility to acquire HIV. Doesn't matter if you're married, because having a wedding ring does not make you exempt or does not make you immune from acquiring STIs and HIV. And people are like, well, I'm married. Congratulations. I am glad that you're married. But it still does not make you exempt or immune. All you have to be is a human who is having sex. That's literally all you need. So I like to lead with that to get people to really think about, okay, this can happen to me. I can be acquired HIV. So in the chat, why do you have sex? So write down all the reasons you have sex, like whatever those reasons are, because I'm obligated, someone paid for it, whatever, right? Whatever. Why are you having sex? Everyone talk about it. Pleasure. What else? That's how I get my spouse to do what I want them to do. That's how I get whatever. What are the reasons that you have sex? I'm available. Okay. Stress relief. Okay. Bored. Good. So these are all reasons, a lot more why people have sex, right? The number one reason people have sex is because it feels good. No one reason why people are fucking is because it feels good to fuck, right? That's just what it is. And because we know that, we know people are going to have sex anyway because it feels good. So let's give them reasons to do it more safely. So I often tell people there is no such thing as safe sex. Safe sex is a myth. It doesn't exist. If you're having sex of any kind, it's always a risk of some sort. Even if you're having sex with condoms does not prevent against like herpes and other types of some other type of STIs. So there is no way to have sex unless you're not having sex at all that it's going to be 100% safe. It doesn't exist. There's things that you can do that can make it safer, but safe sex is a myth. It's not nothing. It doesn't happen. But what if I told you that research has shown that PrEP, people on PrEP have reported back that because they're on PrEP, it has improved their sexual satisfaction. It has improved their sexual adventure, intimacy, anxiety, sexual confidence, and empowerment. And so why is that? PrEP, again, and I'll talk about what PrEP is in a second again, but PrEP, again, is a pill or medication that people use to not acquire HIV. So I associate PrEP with birth control. I'm on birth control because I don't want babies, right? So I take the birth control before babies. You don't take the birth control after I'm already pregnant. It's not going to work. I'm already pregnant. So I'm on PrEP because I don't want to acquire HIV. So because I'm on birth control, there's certain things I don't have to worry about. So when I do engage sexually with someone and maybe we don't use a condom, I know for sure I know about 98% sure that the chances of me being pregnant are slim to none. So that's one less thing I have to worry about. So I don't have anxiety from that. People want to be able to explore certain things without having to have worry. It was shown that people who are on PrEP like to be able to try different things. So, for example, I know people who have told me, I would love to try group sex, whatever that is. But because they feel like group sex is risky or is more risky than having sex with one on one, they were reluctant to try it. However, if there was a pill or some type of medication that could ensure that you can have all the group sex you want, all the nasty sex you can think about, whatever that is, right? And you will not acquire certain things, more people probably would be open to doing that, right? Also, increases intimacy. How does it do that? So, in order to have intimacy, you have to be able to have trust. You got to have feel safe, be able to like feel like you can share all those things. Typically, people, as someone who's on PrEP, I feel like I can connect with someone after the fact. We can share, we can talk because I don't have that extra layer of worry there. And we'll talk about this in a second. All right. So what is PrEP? I said I should have had this slide first, actually. So PrEP is pre-exposure prophylaxis, which is the scientific term that no one's going to remember. Just remember PrEP. It's a drug you use. It's a drug you use before. So PrEP means before acquiring HIV. So it prevents you from getting HIV. That's all you need to remember. So there are two types of PrEP. You have a daily pill and you have a long-acting injectable. So I've been on both. So the daily pill is like a birth control pill that you take every day around the same time. You take every day around the same time. So, for example, if I take my pills in the morning, I need to take this pill every day in the morning for it to be effective. So there's two types of pills. You have Truvada, and then you have Descovy. Descovy, technically both of the Descovy is not for people who are assigned female at birth. Truvada they give to people who are assigned female at birth. However, it was not tested on women in the clinical trial. So take that for how you want to take it. And then you have to go with the pill. You have to go to your doctor to get your labs and get monitored every 3 months. With the long-acting injectable, which is called Apretude, and that's the one I'm currently on now. I go every 2 months. Apretude is an injection, like I equate to Depo. Anybody remember how Depo was back in the day? Okay, I'm dating myself. So Depo was we go get a shot in your arm, but this is a shot in your ass, pretty much a shot in your thigh and your booty. So it's Depo for your ass. Okay. So you go get a shot every 2 months in your bottom area. And while you're there, you have to make sure they test you for your blood, make sure your kidneys and everything is functioning properly. You also have to be negative. So you get a test. I get an HIV test every time I get a new injection. So I get an HIV test every 2 months. And I go home. Literally, why I don't have to like ask any. I go home. I don't have to take pills every day. So for me, I switched from the daily oral to the injectable because I don't like taking a pill every day. I was also forgetful. My life is very busy. Sometimes I'm on vacation, I go places. I don't know, I might not stay home tonight. And it was just a lot to keep up with. With the injectable, I go into the doctor's office and I don't have to remember anything other than my next appointment in 2 months. Also, I tell people that the injectable is also great for people who are in relationships but may not feel comfortable telling their partner that they're on it. Because if you have a daily oral pill, right, people are nosy. People can see your pill bottle. Some people might Google, because I've done it. I've seen people that I was dating. I'm not proud of it, but I've seen people that I was dating. They had all these pills. What is that? You know what I'm saying? Take a picture, you Google, find out what the problem is. And so some people, when they see HIV medicine for HIV, they automatically assume without reading that this means that you must be positive. Blah blah blah. If you're in a relationship with someone and you don't know how to have the conversation, but you feel like PrEP is something that you want to take, doing the long-acting injectable, I feel like is the better option. So side effects. So people, we as women, we tend to be very vain, right? We want to know if we're going to gain weight. We want to know if, make sure our hair's not going to fall out, make sure we're still going to have our teeth, make sure our vaginas are still going to work, how they're going to work. We don't want, if taking this pill is going to make me dry or it's going to make me gain 20 pounds, I'm good on it. This is how we operate, even if it's something beneficial. Women are very vain, okay? So gaining weight is not really a side effect. Some people have gained like 10 pounds, but it's not a common side effect for others. I didn't gain any weight. I don't have hair as it is, but the hair I have, it didn't fall out. It's been cut off before I got on PrEP. I have my teeth, my pussy still work. Like it's literally it's nothing, right? With the daily oral pill, however, some people have had nausea, diarrhea, headaches, fatigue. I did have headaches when I was on it, but they go away over time. But when I first was taking the pills, I did have headaches. With the injectable, the only kind of side effect I have is I equate it similar to the COVID shot, the vaccine shot. If you got a COVID vaccine shot, your arm was tender for a day or two. But after about a week or so, that tenderness went away. So that's what happened with the injectable. You get an injectable, by a day or two, your thighs tender, but by the end of the week, you should be fine. So, any questions so far? Oh, is there a reason why the SCOBY is not prescribed to women? It's not prescribed to women because it wasn't, from my understanding, it was not a trial done on women. So they don't prescribe it because it wasn't originally tested for women. Neither was Truvada, but they assigned that to women too. I don't know. I will say this: the injectable is the only PrEP medication that had cisgender women in the clinical trials. So if that matters to you, they were the only ones out of all three. They had cisgender women, and they had cisgender Black women, if that also matters to you. They went to Africa because you couldn't find enough Black women in America to want to be like, I'll sign up. So they went to Africa and did clinical trials on cisgender Black women in Africa. So yeah, that's where their research came from. It came from cisgender Black women in Africa. But they're the only ones who had clinical trials for Black women.
I have a question.
Yes.
For the daily oral, it says maximum protection after 21 days of daily use, receptive vaginal, and 7 days for anal. What is the difference between the protection for that? Because I know if you were exposed to HIV, they will prescribe you Truvada for 30 days. So what is the difference between that and then actually taking the Truvada as a PrEP?
So in that case, it will be a PrEP. You're taking it after the fact.
After. Okay.
PrEP is before you take it before you come in contact. PrEP is like the plan B.
Gotcha.
I may be pregnant. I don't know. Let me take the pill so I can eliminate just in case. The PrEP, doing it that way, is the reactive way versus the proactive way. That
We
makes
have,
sense.
yeah. Someone else asked, does someone being on hormones affect which style of PrEP is recommended or advised?
So I know that if you have hormones or if you're on have like implants, some depending on what the implants are and how the hormones affect aptitude may not be the best. I do know there are people of trans experience who are on aptitude, so you probably will have to like speak to your physician to make sure.
So you go and get the shot after because you might think you've been in contact with someone. After you do that, is there, like you said, you usually get a test, an HIV test. So after you take that pill, is there a certain amount of time where you're able to get an HIV test, find out that you're negative, and then be put on PrEP?
PrEP is before. If what she was asking me about was PEP. PEP is like the plan B. You go in case I'm pregnant sex with someone, they give you a series of pills after how many days it is, and then you take a test after that, after the fact. Yes, but before, like with me, I get an HIV test every time I go to my doctor, which is every 2 months.
Even with exposure, say when they put you on PEP, right? And then you decide after everything has been cleared with the Truvada because of whatever reason that you were on, that you were exposed. I think what Sir Raven was asking is that, can you decide later on that to avoid this happening again, can I start PrEP after I've done PEP? Okay.
Yes. Sorry.
That is all the questions for now.
How effective is PrEP? So PrEP is between 90 and 99% effective when used correctly. It's safe. Compared to aspirin, most insurances or assistance programs cover it. I know in Atlanta, in most metropolitan cities, they have PrEP clinics. So let me say this. So PrEP's been around for 20 years. So let's say that's been around a long time. However, though, for the last 18 years or so, it's only been marketed to gay men or people with trans experience. That's only people it's been marketed to. So it's been around a long time. So now they're trying to get it out to Black women. And I'll tell you why that is in a minute. But I'm said all that to say most insurances, because it's been out for a long time, they cover it. Or there's assistance programs in your city. A lot of people there's a lot of PrEP clinics, or usually any type of HIV clinic has a PrEP clinic or a PrEP navigator associated with their clinic, and they can get you on PrEP. However, because Apretude, the injectable one, is relatively new, it's only been out 2 years, insurances might not cover that option, and finding assistance programs, they might not cover that. They may just only cover the pills because most gay men are on the pills and not the injection, if that makes sense. You can also be pregnant and be on PrEP. You can breastfeed and be on PrEP. It doesn't counteract with any other birth control methods because, like I said, I'm on birth control. I am on Nexplanon. It's the implant that's in my arm. I've been on it for almost 8 years. I'm fine. Let's see. So why is PrEP, right? Why is it important? So according to the CDC, there were 26 million newly sexually transmitted infections in 2018 in the US. And half of those infections were between people of 15 and 24. Most young people are hesitant to talk about sex with a provider, and they also don't have insurance. So it makes it difficult for them to go to get testing. Also with that, people assume just because the young people are the ones who are only at risk. That's not true. Older people underestimate their risk and not as cautious because they don't use condoms. I was reading an article a couple years ago about how now nursing homes have become like the breeding ground for STDs, right? Because grandma and papa in their generation using condoms wasn't really a thing. They like, they didn't really use, they didn't use condoms back in the 40s. So they're still having sex like they did when they were 20 and they were in their teenagers. But now there are all these things you have to worry about that was not a thing back in 1935. And so now we are seeing that they are also acquiring STIs at a higher rate than normal, because they're on the assumption, I don't know what that is. That's not going to happen to me. But again, if you're having sex, you have the possibility of acquiring any STI. This was taken in 2018. So 1 in 5 people in the US have an STI. That's nearly 60 million infections. I'm sure that number has increased, because if you remember, like over the summer, there was a research that came out in Texas, how like the STI rate, I think it was gonorrhea or something, had increased by 160%. And people were like, oh my God. So I'm sure that number is higher now. But 1 in 5 people in 2018, this is also pre-COVID. We also know post-COVID that STI rates increased. So keep that in mind. So it's probably like 1 in 3. This is disparities in STDs present among racial and economic minorities groups. Hispanic people or people of Latino descent are 1 to 2 times higher than people who are non-Hispanic or white people. American Indians or Alaskan Natives are 3 to 5 times higher. And then Black folk, people of African American descent, are 5 to 8 times higher. And there's several reasons of why this is. We can talk about that, but we are 5 to 8 times higher for acquiring STIs. And this right here is a national statistic. So this AIDS view, this was 2021. So the darker the state, the more cases of HIV is in the state. The lighter the state, the less numbers. By this map here, we can see that the HIV numbers are more prevalent in what states? In what region of the country? The South, right? The South. We have a couple over there in California, but California is it's a big state. And we have some up here in the North, but it's more prevalent in the South. So I also tell people that it's not so much that you are participating in what is called risky behavior so much. It could be just by where you live. So let's say I live here in Texas. Texas is dark red, right? So Texas, let's say Texas is a pool that has 100 piranha. Let's say I'm swimming 100 piranha in Texas, and up here at, I don't know what state this is, near the Canada border. What is this? Who knows what state this is up here? What state is that? I'm not good with geography. What state is that?
Yeah, couldn't tell you.
Okay, one of them near the Canadian border, one of those states, right? So let's say that's a pool of 50 piranhas. So let's say I'm swimming in a pool. I'm swimming. If I'm in the pool with 50 piranha, I am less likely to get my toe eaten off, right? Because it's just not that many piranha. However, if I'm swimming in the pool that's in Texas that has 500 piranha, I have a greater chance of swimming with and coming out with no limbs. So that's how it is. I get people with dating and having sex. It may not be that you're doing anything different, anything wrong per se, but I'm just here swimming, and I just happen to be swimming in a pool that has more piranha than my counterpart 3 states away. That's just it. I'm dating, I'm having sex. So if you are someone who lives in the South, the probability is a lot higher just by where you live.
And that state was North Dakota.
Oh, North Dakota.
And then to the left of it is Montana.
Montana. It also points out like who lives in North Dakota and who lives in Montana. White people, right? I'm sure there's black people in every state. I'm pretty sure, but the number of black people in Montana and North Dakota is probably not that high. So we have white people, and we already said that we are 5 to 8 times higher at acquiring STDs than white folks. So in 2021, there were 36,135 new cases of HIV in the US, 22% of which were attributed to heterosexual sex. This is important because people automatically, I talk to women a lot, and they automatically assume because they are heterosexual that they are exempt from acquiring HIV. You are not. Again, all you have to do is to have sex. And actually, outside of gay men, or outside of gay men and people trying to experience, heterosexual women are the third highest group of HIV cases in America. Third highest. That is why they are now promoting PrEP to heterosexual women, and particularly heterosexual women of color.
Do you have, I have a question. Do you have a theory of why that is?
Yes, I think a couple reasons. A couple reasons.
Yes, I
One,
have a theory.
okay, what is your theory?
My theory is that Black men are maybe dipping in that pool of gay sex, and sex is just pleasure. And because they don't talk about it, they sleep with heterosexual Black women and are more likely to convince them that a condom, you don't need that kind of a thing. And they may be and they may be passing it on to Black women. That's my theory, and I'm sticking to it.
And that's my theory too. Part of it, I don't want to stigmatize because I don't want to stigmatize and say that the reason why Black women are acquiring HIV at the rates that we're acquiring is because all our men are straddling the fence. But I do think that is a reason because we are not very. I've heard men say this when it comes to women that they are engaging with. We are not very open. We want people or our men to share and be open and provide this soft place for them to land. All those Instagram words. But in real life, when they tell us things they want to do or try, we shun them, we shame them. So that makes them not want to share, and they do stuff in secret. They come back and then they're with us. I also feel like we as Black women, we give a lot of our power to whoever we're dating, meaning if the person we're dating because we want them to like love us and be with us and not think all the things about us, if they say, oh, we don't use condom, they're not gonna use a condom. Like, okay, I'm not gonna use a condom because I love him. I'm not gonna use a condom. I don't want him thinking I trust him. I don't want him to think that I'm cheating on him. And then two, Black men don't go to the doctor. We know that. They don't go to the doctor. Even like outside of STI, they don't go to the doctor. Me and my mother are fighting with my father, who now in his 60s, whose health is shitty because he don't go to the doctor. They don't go to the doctor. So by the time, even if you have HIV, because you don't know your status, you're just passing it along. When you could have HIV and get on the right medication, and you could be untransmittable and undetectable and untransmittable, that means you won't even be able to transmit to the other person, which still, that's a good thing. If I know someone had HIV but was on their medication regularly, and that means that I couldn't get it, you know what I'm saying? Hey, that's a whole different ballpark. But if you don't even know you have it because you haven't gone to the doctor and you're just like passing it along, then that's a whole nother issue.
I was just going to say the same thing. As someone who started their career in the field of HIV and AIDS and doing testing and counseling, the majority of people that came in or that didn't come in for testing and counseling were Black men and Black women.
Mm-hmm.
So a lot of people and the organizations that I worked at had free HIV testing, free STI testing, and they weren't coming in. So
Yeah.
you would see more of gay men and those of trans experience that were coming in to get tested regularly, but it wasn't Black and brown folks that were doing it.
And I think too, ViiV has this whole campaign, it's called Risk to Reasons, where you're trying to replace the word risk with reasons. I think a lot of times we as Black women don't really see ourselves. Or we think the other women that we do know who are positive, we were like, oh, they acquired it because they were sluts or they were IV drug users. I don't do that. I don't do that. I've been married to my husband I met him in high school and we got married at 21. I don't do that. You know what I'm saying? I'm a classy lady. I have sex with one person. I got two parts my whole life. I'm not a hoe. Like they feel like because what they deem themselves as this this self-righteous, unslutty person, they feel like they are not, they don't see themselves. So what ViiV is trying to do is give people reasons, cut out the risk. Because if you say risk, people are not going to see themselves as that. And we don't want to associate what we do as risky behavior. Nobody wants to do that, not really. So we give people reasons. So what is your reason for wanting to have prevention? See, my reason, Ashley's reason is, I'm being honest, I don't like using condoms. No one has ever said, oh, I cannot wait to have sex with a condom. Not really. We use condoms because we have to, and it's a means of like a safety means. No one uses a condom because we just love the way they feel with condoms. No one's doing that. No one. I don't like using condoms. So one of my reasons for getting on PrEP is because I don't like using condoms. I like raw dogging. I just do. I like it. Also, one of my other reasons for getting on PrEP is because I like to have adventurous sex. Whatever that is for you, whatever you think that is, I like having adventurous sex and not have to worry about it the next day. I don't want to have to worry. So, and that's, I think, a lot of people. Also, I like being able to not have to have the anxiety of, oh my God, let me go run, get it. I don't know what happened. Let me go get a plan B. Let me go down here to the clinic. I don't want to do all that. Now, yes, there are other things that you have to worry about, but at least I don't have to worry about this. When it comes to the STDs, STIs, like HIV is the boogeyman. Like no one really cares about chlamydia and gonorrhea, and because you can go get a pill for that and you can be gone in like a week. No one really cares about it, which is sad, but no one cares about catching chlamydia, unfortunately. I see it's a question up here. Hold on. Oh, that part. Yeah. No one cares. Oh, shoot. Hold on. What happened? No. Backspace. Sorry. Yeah, so no one cares. All right. Next slide. So that's me in the middle. In case y'all couldn't tell, we did a campaign. So why PrEP matters. So 30% of Black people with HIV in the US still don't know their status. Again, that goes back to people are not going to get tested for various reasons. Also, people don't really trust Black people. We have a very dark history with medicine and doctors, right? Which I totally understand. I totally get why people don't trust medical science. Black and African American women continue to be disproportionately affected by HIV, making up 54% of new HIV cases. This is in 2019. I'm sure it's higher than that by now. 91% of new HIV infections were attributed to heterosexual sex, while the HIV infection rate among Black women was the highest compared to women of all other race and ethnicities. Also, I think this is important to point out. Why do you think that we are acquiring HIV higher than white women who are also married to white men who also have HIV. White people get HIV for years. It ain't nothing. HIV and white people is not new. As a matter of fact, when it comes to white people, HIV is almost eradicated because they have been taking the pills and the PrEP and all these things way longer than we have. So having a new HIV infection in white folks it's almost not even a thing no more. Why do you think that is?
Possibly better health care for most.
Yeah.
Racism, let's keep it real.
Right. So
where you live, poverty, a lot of those things play into that.
I found it very interesting. I was talking to someone at a conference one time, and this was like, she said 10, 15 years ago, white women were coming into the clinics to get PrEP because they knew their husbands were engaging in whatever type of risky sex, whatever it was. So they were coming in to get PrEP 15 years ago. 15 years ago. So like they were coming in, getting their pills and going by their business. But yeah, but we didn't know anything about it. And only 8% of Black African American people who can benefit from PrEP are actually on PrEP. And I'll show that in a second. Chat, what is this? It's 60% now. What was the question for that, Miss Liquid?
Disproportionately, and that was 2019. Now it's, I think in 2021 they said it was at 60%.
That sounds about right. All right, let's just move this over here. So this is a map of all the PrEP users at the top in the United States. So this is the map. And at the bottom is the number of women who are on PrEP in the United States. This is not broken down by ethnicity. So probably most of these are probably white women, but it's a big difference, if you can tell. So that means most of the people who are on PrEP in the United States are men, or people who were assigned male at birth. So I thought this is a good slide. All right, so being on PrEP can facilitate sexual expression and sexual agency, right? Because again, like I told you before, a lot of people who are on PrEP, when they say they're on it, they say they have the ability to try different things. It lowers their anxiety. They can pursue sexual relationships without fear or shame. And it also removes the act of HIV prevention from the intimate act of sexual activity, right? When you use condoms, it puts the HIV prevention with the act of sex. With PrEP, it removes it, right? It's not on your immediate mind. When you use a condom, let's use a condom because I don't want to acquire anything. I don't want to get pregnant. So it does those two things. So is PrEP right for me? So PrEP might be right for you if you are HIV negative. So you have to be HIV negative to be on PrEP. That's one of the things I tell people. I post on Instagram all the time about me being on PrEP and being HIV possible. And every time I post about it, every time someone's in my stories talking about, oh my God, I didn't know you were positive, which is fine. I don't have any issues with it, but people don't read. And people say PrEP medication for HIV prevention, and they automatically assume that you are positive. Black folk don't read, okay? I don't know about white folk. I've been Black my whole life. We don't read. So if you've been sexually active in the last 6 months, if you do not use condoms or other barrier methods like myself, if you were diagnosed with an STI in the last 6 months, if you are willing to take a daily pill or go to a bi-monthly clinic to get a shot, I think it would be a good idea to take a woman-controlled method to prevent spread of HIV. Woman-controlled. I tell people that too because you are in control of your sexual health. When we are out here not really like on anything, we are trusting our partners. I know we ask people when last time you were tested, right? And the common answer is everybody 3 months. 3 months. That's what everybody say. That's the common lie, right? But unless you have seen paperwork, you don't know. people make up stuff all the time. And now they have a thing where people are actually making up, falsifying test results. It's a whole thing down here. It's in Atlanta. I don't know, maybe it's where y'all stay, but it's down here in Atlanta. The reason I know that because I go to a sex parties, and in one of the sex parties, you have to bring like paperwork of make sure if your last time you had an STI test. And at one of the parties, I'm not sure how they figured it out, but someone had falsified documentation. Like they made it up. So you don't know what someone is doing. People say things all the time. Men lie, women lie, the numbers don't. So it's a good idea if you're having sex to make sure that you are in control of your sexual health. And I know that I'm in control of my sexual health because I go to the doctor every 2 months to make sure of it. It's regardless if my partner's been tested or not, which I hope they have, which we talk about it. But even if they lied about that, I don't have no worries because I know Ashley good, because Ashley doing what she's supposed to do is to take care of Ashley, regardless of what they're doing or not. So my reasonings, and remember we said we're trying to get rid of the word risk and get reasoning, so that way people can better relate to it. My reason is I don't like to use condoms, like I've already said. I don't like having to worry after sex. I live in the South. If you notice in our little map there, in the South, and in the South is where HIV is highly concentrated. I'm a Black woman because Black people is 5 to 6 times higher. And I'm being in control of my sexual health because I'm a Black woman. I live in the South, and I'm having sex. Those are already 3 things that are going against me. Just because of that. And I haven't even done anything. Just have sex. I live in the South. I'm a Black woman. That's it. And this is what Master Liquid was talking about. So PrEP versus PEP. So PEP is post-exposure prophylaxis. PrEP is pre-exposure prophylaxis. So post means after. So you take PEP if you think you've come in contact with someone who is HIV positive. It must be started within 72 hours of exposure, like a Plan B. I can't take a Plan B 2 weeks after. It don't work like that. You got a window to get rid of that, to get rid of whatever you got. So you go 72 hours, go to your healthcare provider, and most people, emergency rooms, for people who have been raped, this is what they're giving PEP. That's what that is. So you can go to any emergency room, any doctor's office, any HIV clinic, any place that has PrEP usually also has PEP. So you go to a healthcare provider within 72 hours. And if you don't know if you've been exposed, like if the condom broke, you're sharing needles, or if you've been sexually assaulted. So that's what PEP is.
I have a question. Do you think that for Black women, another thing that contributes to them not wanting to be on PrEP is the ignorance of some medical providers? And what I mean by ignorance is like if you're not good with advocating for yourself, especially in the medical field, when you ask for something specific, whether it's a birth control, whether it's anything, sometimes you get doctors that are like, what do you need that for? And it's because I asked for it, I'm sexually active, and it makes them feel uncomfortable because that stigma about how much sex you're having. I know I see that with older adults where if they go to their doctors and they're asking for STI tests, and like you said in the beginning, which is true, nursing homes have the highest STI rates, especially down in Florida. It's a big retirement swinger state. They are always asked, why do you need that? As if older adults aren't having sex. And older adults are probably having sex more than any of us in this right now. But that stigma of, I'm coming here to protect myself. Why are you asking me, why do I need something that is going to keep me safe and healthy?
Yeah, so this is a conversation that we have. I have these conversations with healthcare providers too. And so I know that healthcare providers are not trained to talk about sexual wellness with their patients. They should be trained, but they're not. And in a lot of cases, when people come in to talk about things, I've heard people say, this one person, I remember she was telling me she's married, and she wanted to get on PrEP. I don't know the reason, but she wanted to get on PrEP. And her doctor was like, you're married. Like, what you need to get on PrEP for? Right. And then you have people who are not married, but because their doctor, they asked them, I want to get on PrEP. Are you a sex worker? That's what their doctor has asked them. Right. I think a lot of that is that you have doctors who are ignorant, and you would think that the healthcare professional, because again, PrEP is not new. It's been out 20 years. It's not new. That they will be a little more educated and a little more knowledgeable as to why it's important, and why people who outside of those who are in sex work, and nothing wrong with sex work, right? Sex work is real work. I can't do it because I don't have the stamina, but shout out to those who do. But if for people who are outside of the sex work field, why you should be a little more educated as to why it's important for them to get on it. Sometimes doctors are deterrents, and how they say stuff, how their facial reactions read when they tell you things, it makes you not even want to try. I've heard a lot of people who just been following my journey on Instagram. One girl, she was saying how she went to talk to her doctor, and they were like, they didn't think that she needed to be on it, like what she needed to be on it for. You asking all these questions. Luckily for me, I just went to a PrEP clinic, and usually at PrEP clinics, that's their job. Like, trying to get many people on PrEP as possible. So you say you want to get PrEP, cool. So the paperwork out, they're not gonna ask you really any questions other than, okay, last time you had sex, do your HIV test, and you can leave the same day with medication, because their whole job is the clinic. They get funded by how many people they get on PrEP, versus a regular doctor's office who might not understand the reasoning behind it. So I always tell people, try to go to a PrEP clinic in your city if you have one. And usually most, like I said, most metropolitan cities have a PrEP clinic. That's what I have found.
Yeah, because even I see it like even with getting tested, that's like a challenge for people because they feel like they're getting interrogated for asking for something that they need. I know I have been through about 8 or 9 gynecologists that I fired until I found the right one, which is an amazing Black woman. But I remember a previous one that I had when I asked for a specific birth control, even though I am cut, tied, and cauterized and can't have any more. They were like, why? Don't you want to have any more kids?
Mm-hmm.
No.
No, I don't. That's why I want my tubes tied, ma'am. I don't want no more.
Or when my daughter, when she had her implant in, she was having a very bad reaction where she had her menstruation for 6 months straight and wanted it removed. And the doctor, this older Nigerian man, was like, why do you want to take it out? You want to get pregnant? Like, very defensive towards her. And she's, no, I've been bleeding for 6 months. I don't want this in my body. It's not working anymore. And we fired him on the spot. But I think that can be a deterrent for people going in to want to get tested for any STIs, including HIVs.
And I think too, we have to know that we can fire our doctors, right? They work for us. If you have a doctor who, I don't know, you don't like the way they talk to you, or they didn't think to really care. I know I used to have a primary health doctor when I was growing up. She was the only Black female doctor in our town. All the Black people went to her, right? However, because she had so many patients, the wait time was hella long. And when you got into when she exam room, she was like, she came in, okay, let's see what it is, and then she left. It was no type of conversation or talking about, okay, what brings you in, and I knew it was because she had so many patients. However, for me, I like a doctor who I can have rapport with. You might not need to know, what I have for breakfast, but at least act like you care about something. And so I quit going to her, even though she was a Black lady. But sometimes it's okay to fire your doctor and find a new one. And you might have to fire a couple. When I was on the pills here in Atlanta, I wanted to get on Apretude, the injectable. And the clinic I was going to did not offer the injectable. But they didn't tell me that at first. I came and I was like, okay, I'm here to get PrEP. However, I want to get on Apretude. I told them that when I went in. And so they were like, okay. you have to do like an insurance thing first for Apretude. Today you can leave with Truvada, blah, blah, blah. Cool. So I did my 3 months of Truvada, went back to the doctor. I'm like, okay, so I did 3 months. Okay, so what about Apretude? They was like, oh, they some BS answer. And so basically I realized that I was never going to get what I wanted. So I left them and went to a different clinic who was female ran, and they actually had Apretude. So I left there and went to the one that would actually give me what I wanted. So any questions? So these are some questions that people ask me about it. So I'm going to just read the questions and answer them. But if you have any other questions about PrEP or anything like that, you can just put it in the chat, or you can just unmute yourselves and we can do it that way. All right, how and or why does PrEP help me to feel more relaxed and experience more pleasure? So for me, again, like I say people all the time, I feel very hypocritical because as a sex educator, because I also work with college students. I do presentations on college students, and I go to campuses and college students, and I'm telling these college students they should wear condoms, right? Go and wear condoms, blah, 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 which I still think condoms are important. However, I don't use condoms because I don't like them, right? So I feel very hypocritical telling other people to use condoms when I actually don't use condoms. So for me, what PrEP has done was help me to experience sex the way I like to experience it, which is condom-free sex, right? And so and also that for me, that condom-free sex is more pleasurable than condom sex. So that's what it has done for me. What is your wildest unfiltered sex take and how does it connect to my PrEP usage? So for me, I also like to engage in, I go to sex parties and sex clubs. Technically, at sex clubs, there are condoms there, and I suggest people use condoms with total strangers. I totally believe that. But however, sometimes if you're there with your partner, y'all might find somebody y'all want to add to the mix. It's one less thing I have to worry about. It allows me to be able to live out all of my fantasies without having to worry about that one extra thing. So that's why I like it. What's something you always want to share about your PrEP and pleasure journey? This goes back to, again, about me not wanting to use condoms, and also goes back to if I'm on PrEP, I'm able to enjoy sex because I don't have to worry about what somebody else has or doesn't have, or if they got tested lately. And again, I still have to worry. You still have chlamydia, syphilis, and gonorrhea are still real things, and you still have to worry about those things. However, in most cases, you can get rid of chlamydia, gonorrhea, and syphilis with a pill in 3 days. After 3 days. Ask me how I know. I've had chlamydia before. You just take some pills, and 3 days is gone. So I don't have to worry about that, and I like not having to worry about it. Any questions so far?
I actually have another question because you brought up a really good topic.
Yes.
Regarding people faking their results. Come up in New York. So what I do, if like most people, I can't say I go visit my doctor regularly. I'm a bit of a hypochondriac, so that's just me. But most clinics and doctors' offices have apps for your results. So I prefer, you can pop open your app and see right there what your results are if you wanted to ask somebody versus, oh, send me some papers that they could have easily pulled off of Google or photoshopped or something. So that's my preference. I use my app. My app is always on my phone. That's the way you can go. Like I said, most even free clinics have, because COVID changed the way we received our results, have apps where you can get your results right there, ready to go.
Yeah, my chart is lovely because like literally you can just pull up everything on your my chart. And then you also can pull up if someone goes to the doctor regularly, you can pull up their my chart and they can tell you last time they got tested, what it said, and all that stuff. I don't be trusting men. They be lying.
I have another question. I know back in the day, some parties used to be able to give you an HIV test. Is that an option for this? You're talking about like sex parties and people faking it. Is there I want to say a quick kind of way that you can.
Mhm. So I have gone to parties, or I've heard people at parties doing HIV tests. Some people, it's a deterrent because who really wants to find they had HIV at a party, a sex party?
You're right.
The buzzkill. But I do know some people. I do know some agencies who do it, so it is a thing. Yes.
There's also, but it's not a foolproof thing because there is a 90-day
Yes.
period, so they might test negative within
Correct.
that time, even after exposure.
Correct.
That's true, but I'm thinking if you're at a sex party, and I get it, it may be a deterrent, but if you're trustworthy, if you are showing, and this is just me, I'm an Aquarian, I think humans have a chance. If you're showing, yeah, I'll take a test. You know what I'm saying? And even if there's that space that you still do have to wait, if you're willing to take the test and you're seeing somebody, if you're at a sex party that you may want to get with and they're willing to take that test and you're already on PrEP, you may want to get with that person because they were like, I'll take the test. Or is that just me? I wouldn't do it, but
At a sex party, let's be clear. I would take it, and someone took it up at a sex party, and even though again it's a 9-day window, that they still could be positive, I would still feel. I would still have sex with them because I would feel safer. I don't know.
Mhm.
So I would still do it. I'm just saying that some people look at it as they don't want to do it because who wants to do that at a sex party and they come back negative and they come back positive. There's a whole thing you have to go through. Yeah, but I think I'm with it. I would do it.
And also when you were talking about like doctors, I do know that Black people, I'm not going to say all Black people, I've had my own experiences with having to advocate for myself, but Black people have a history of believing a thing, right?
Mhm.
Because this doctor is saying something,
Mhm.
or and they don't, excuse me, they don't have, for whatever reason, historical, I'm sure, has a lot to do with it. They will not advocate for themselves in a certain way
Right.
to say, no, this is what I want, and this is your job to do it. Like you said, they work for us. And so I think also having to advocate for yourself and maybe wanting to go get the test, but maybe thinking you'll get that pushback from your doctor because you didn't think, let me go to this clinic that was going to actually give you the thing that you want. That can be stressful.
I agree.
And so instead of having that stress, they just don't go.
Correct. They just don't go. Like, yeah, they just rather be surprised later, I guess.
And depending on like your finances and what you have, most pharmacies you can buy over-the-counter STI tests or HIV tests. I know Quick and a couple of other things out there if you don't want to go in, if you're concerned about embarrassment or you're shy or you're just uncomfortable going into a clinic, you can go pick one up and go home and do it yourself.
Yeah, and then like most places, I know the CDC has it for free. And a lot of places, if you Google free at home HIV tests, now some places you can get them for free.
Yeah.
They'll ship it to you. It might take a week versus go to the store, you get that same night. But you'll get them for free. And they usually send 2 at a time. So I also suggest that too. I also tell people if you don't want to go to a clinic, because let's be clear, sometimes going to clinics, especially if you go to a clinic in a small town. Like I'm from a small town in North Carolina, and my cousins work in the health department. Now I don't care, but Now, what if I was in there and I went for HIV test, or I went there and I had gonorrhea, chlamydia? My cousins could be like, "Girl, I saw Ashley here," and I know it's a HIPAA violation to tell my business, but we know people tell people business. I actually got chlamydia. Now it's just I know how I've been Black my whole life, right? I know how we operate, and some people don't. Some people don't want to go the places because their relatives work there, or their family, or their people that they know. So I get it. So doing it at home test, even though some people don't like at home tests because what happens if you get a positive at home, but I like at home tests because at least you don't. I like at home tests because I can file out in the comfort of my house. So these are some resources to know if you're looking for like PrEP, how to locate PrEP clinics. PrEPlocator.org is a website, and it lists all the places in state by state which have PrEP, and you can easy way to find it. Amaze is also another sex website, and Sex Etc. is a sex ed website. Kim Brighted is a black sexual health website by two Black women. I like stuff with Black people. Afrosexology is also another sex ed website by two Black women.
I have one more question for you. Before you decided to take PrEP, did you have any fears around taking PrEP, and what was the deciding factor for you to go on PrEP?
So I went on PrEP because I wanted to be able to walk it like I talk it, right? If I'm a sex educator and I'm telling people about PrEP, I just feel like it was way more effective for me to tell people to be on PrEP if I was on it. It's easy to be like, oh, you should get on this drug, but are you on the drug? No. You know what I'm saying? Like now, because I'm on it, I know how it reacts to my body. I know the side effects. I can tell you from my own personal experience. So I wanted to be able to lead by example. So that was really my reason for getting on it, honestly. And then I found other reasons after I got on it, but I wanted to like lead by example. If I'm telling other people what they should do, I should be doing the same thing. That is, yeah. And I didn't really feel away because again, I'm a sex educator and I talk about sex all the time. So I didn't really have any hesitant to get on it. It was just, okay, let me just get on it. But that's also, I understand that because of my career, I'm in the field. And so I have a different experience than most people.
You were saying that Veeb has this campaign of taking away the word risk and putting reasons, which is fantastic, right? Because when we are dealing with Black folk and Black women, sometimes you have to ask the question, what is the reason why you don't want to do a thing?
Right.
And to get them to start thinking in that kind of way, to really open up and have the conversation. But also Black folks, some Black folks tend to not know how to talk about sex. Everybody is a freak, right? But no one knows how do you talk about sex in a way. And then there is that thing that sometimes there are people who don't know how to advocate for themselves in bed. They're just
so it's very taboo amongst people, Black women, right? I remember when I first started doing this, people would look at me like I was crazy. Again, I'm from a small town in the South, so I grew up going to church and all these things. And Black people, we don't talk about sex out loud. Hell, we don't even really talk about it amongst ourselves either, to be honest. But we definitely don't talk about it out in public. What you doing, right? So when I started doing this, people would look at me like I was crazy. My mother was like, my mother is a typical Black Southern belle. Whatever you have in your picture, what that is, that's what she is. We don't have anything in common really, other than the fact we look alike. That's it. But she is very much like that, and she was like, she didn't understand why would I want to talk about sex. I remember she asked me, and she was like, "Does this mean you're having sex with all these people?" Yes, mother, it does, right? I'm a sexually active adult. So yeah, the only way to make sex less taboo is to have conversations about it. And we normalize it by having conversations. So that's my whole goal in life, is to make sex less taboo and normalize it amongst Black people, so that way we don't feel weird or awkward or feel like something's wrong with us. I tell people all the time, there's no such thing as white people sex. It's a sex. If you into kinky, okay, you into kinky. It's some people think, oh, I can't do that. That's white people sex. No such thing. It's sex. Whatever you like, that's now Black people sex because you're Black. That's it. So yeah, I can't remember what the question was, and I don't know how I went on that tangent, but yeah.
But it was a good tangent. I
Okay.
really, I really appreciate it, and that's one thing that BLX really wants to help our community in a whole, not just LGBTQ plus community, but the heterosexuals need it too. You know what I'm saying? To talk about sex amongst ourselves, and hopefully feeling comfortable enough to talk about it amongst ourselves. Because you may be talking about it amongst your close-knit friends, and even then we know you lying.
Right.
Just saying, like you, I've been Black a whole lot longer than you.
Uh-huh.
I am much older, but that is part of the purpose of this, is to normalize talking about sex, talking about Black sex. Everyone wants to talk about Black love, and love and sex are two different things.
True.
And so to get people to be honest with themselves a little bit, even if you're just listening to a conversation, to get you to think more about how we can help each other in those ways, and maybe give you some tips on how you can advocate for yourself in and out of bed.
Because like you can't, the biggest question I get from women is how to have orgasms, all these things, right? And I always ask people, do you know what you like? The biggest reason, the biggest way to have an orgasm is to figure out what you like. So once I know what I like, I'm able to communicate that to my partner. If I don't know how to tell you how to please me, I'm going to continue not have orgasms because I don't know what I like or how to tell you how to get there. So yeah, you need to be able to communicate. And then we are not taught that. I often wonder, this is not related, but I often wonder, like with white people, because they seem to be so open, so free about sex. But I often wonder, do they have conversations when they're kids with their kids about sex and like how to have conversations with their partner? Because they seem to be just open to all the things, right? And no one kind of seems to shame them. Or I wonder, like in a white household, are parents talking about sex with their kids? Because Black people are not. And then we are left to our own devices to try to figure this out. And yeah, and we're not doing that great of a job.
Do you think that, and now that we're really off the topic, but I have a question because you said that sometimes it might be because there may be the threat of violence, even if it's perceived violence,
What you mean?
right? So if you are being intimate with someone and you don't want to do a thing that they may want you to do, you may give in to doing it because there may be that perceived
Oh, okay.
violence. I think there may be some of that as well.
Yeah, that's probably is true. Mm-hmm.
Yeah. And when I say that, I'm not saying that, I'm talking about violence in general. So I'm not saying, I'm not putting the perceived violence on just one gender, one sex. Violence is violence. It comes in many forms. It doesn't matter who you're in bed with or whatever, right? There may be that perceived violence because there's sometimes a power difference in that kind of scenario.
Okay, that makes sense.
And also, sex education in our school system has failed our children because all they talk about is reproductive health.
Yeah.
And it doesn't go beyond that. It's like, here you can make a baby with this, and you can carry a baby with this. And there is no real talk sex education in schooling. I remember way back in the day when I was in school, it was more of a fear tactic than anything else. If you have sex, you can get pregnant. If you have sex, you can get a disease and die. And that was that. There was no talk of pleasure or what it can be. And if you think about how far we come, even now, if I'm correct, I believe PrEP is provided at the youngest age of 15. I think at 15 in New York, I know 15 you can
Sure.
get PrEP.
I need to ask what that is. I need to ask in Atlanta.
Yeah, I know in New York City you could get it at 15 because there were so many young children having sex, and the population here in New York of especially young LGBT youth here testing positive, so they allowed it at I think the earliest of 15.
That makes sense.
And you're right about the sex education because, again, I've been Black a long time too. And my sex education, I was telling this to someone, we saw a movie. They showed us a movie. It was a black and white movie. I was born in the 60s, so that'll tell you, right? And it was a movie about an egg that had on a tutu and a sperm that had a top hat. And they did this little dance. And then afterwards, they showed them smoking cigarettes. That was the sex education that I got in school.
Oh wow.
Yeah.
Oh wow. That's interesting. And even now in 2020, what year is this?
23.
Georgia is an abstinent only state. And a lot of states in the South are abstinent only. They don't want to teach anything about prevention. It's they only want to teach don't have sex. And this is 2023 still.
We are at that time. Thank you so much, Ashley. Before we go, how can people find you if they want to follow you on social media and all of that good stuff?
Okay, so before I go, I want to talk about this. I am a part of a campaign with Black Women Health Imperative. It's the I Am HIV Possible campaign. So it's www.IamHIVPossible, and it has like different resources for people, how to get tested, where you can like find all the resources about PrEP and why as a Black woman you should be taking it. So I just want to throw that out there. And then you can follow me on Instagram at what is my thing? Sex with Ashley. I'm Sex with Ashley on all platforms. So sex on Twitter, Sex with Ashley, TikTok. So it's all Sex with Ashley.
Thank you again so much for your time. It has been a very informative workshop. We greatly appreciate you. And thank you to everyone that came out. I hope you all have a good night. And yes, please get some more information about PrEP. If you're into it, go to a PrEP clinic, go see your provider, take care of yourselves and each other. Thank you so much. Bye, everyone.